Hi, welcome to the episode 5 of Cat Talk by Alice Cat Expert. Today we're going to talk about what is actually clinical animal behaviorist, because you hear me mentioning this term in the past few episodes, and I figure I should probably have one episode to explain what that means and what are the other related behavioral role that I would mention in this podcast. First of all, you will notice the word clinical. So, clinical animal behaviorists are trained to assess behavior as potential welfare or mental health issue. We are here to identify contributing factors. We're here to formulate a behavioral diagnosis. We are also here to design a structured treatment plan for you. Usually, the training of a clinical animal behaviorist involve postgraduate studies. In my own training, I have honestly have done some math. It's spread out in 3 years. I have read over 700 research papers because I kept a record of that. And in relation to assignment, I have written 65,000 words on assignment. It was really stressful and I actually don't know how I managed. We also have to pass through multiple exam, and for some exam, I actually have to pass multiple times because for certain module, even if you answer like just a small bit of the question wrong, then it's an immediate fail, such as when it comes to safety issue and risk assessment. If you got that wrong, that's it, you're out. And the reason is very obvious because if you can't get the safety and the risk assessment correct, somebody can get hurt, either the human or the animal. So our training doesn't just only focus on training techniques. We also learn about behavioral science, learning theory, how to maintain emotional state, stress physiology, behavioral diagnosis, risk assessments, as I mentioned before, how to structure a treatment plan that not only for the benefit of the animal but also workable for human because every family have different dynamics, and also how do we follow up long term in some more complex cases. So basically, clinical animal behaviorists work on animals' mental health. We do not diagnose or treat any physical illness. That would be the role for a veterinarian. Of course, in reality, mental health and physical health are often overlapped. As a result, we often work as a team. For example, if a case involves pain, neurological issue, metabolic issue, or urinary issue, or digestive issue, in that case, often is a case of teamwork. Now, what about animal behaviors then? Sometimes people call me animal behaviorist, which is not technically wrong, but it might be a case that you need to check if that particular individual actually do clinical work. Because I know colleagues who are animal behaviorists, but they don't do clinical work. They do research and teaching. How about animal trainer then? Now, animal trainer, they might be there to focus on teaching technique, not only to teach the animal, but also to teach the person so that you can replicate the same result at home. They are often there to modify specific behavior. Some clinical animal behaviorist happens to be trainer at the same time. So I am also a little bit of a trainer as well. So sometimes there's some overlaps. You might also hear the term behavior consultant. Now, this one is a little bit more tricky because in some jurisdiction, you're not allowed to call yourself behaviorist unless you have a PhD or unless you are a vet yourself. So, as a result, some of the colleagues will call themselves behavior consultants because of different jurisdiction requirement. In this case, you might want to check out what that individual's qualification actually are, and then get to know more about the experience and background. Another term that you might hear is veterinary behaviorist. A veterinary behaviorist is first and foremost a veterinarian who also gone ahead to receive extra training to become a clinical animal behaviorist. Often it might involve residency training board certification, depending on jurisdictions, and also advanced behavioral medicine. Veterinary behaviorists can diagnose physical illness, prescribe medications, and also do behavioral assessment. To make things more complicated, there are veterinarians out there who gone on to have extra educations in behavioral science. They might not be technically veterinary behaviorists because they haven't passed the board exam, or maybe it's not a term that they're allowed to use in their country, but they know a lot about behavior. And then, of course, on the internet, you also have people who call themselves animal whisperer or animal psychic and so on, all these terms. Oh, and also animal communicator. And those individuals are not providing a animal health care service. They're providing a completely different kind of service. Now, in reality, how does it work then? If you need help, the first line of action I would recommend is to speak to your veterinarian. And if your veterinarian realizes that it's probably a behavioral issue, there are several options. If possible, you can try to contact a clinical animal behaviorist. Sometimes I have colleagues who don't do the training. They might do the diagnosis and work on the training plan, and then will refer you out to a trainer to help you to implement the training plan. In more complex cases, there's a chance that you get referred again to veterinary behaviorist. In reality, for complex cases, it's usually is a case of teamwork between the vet and myself. That just because I happen to also do cat training. For some of my colleagues who don't do training, then they might also have to involve a trainer to help with the implementation. What do I mean by complex cases? I can just list a few, such as aggression, such as compulsive behavior, such as cases that involve medication, and cases that involve neurology or pain or any other medical issue. Because the industry is quite new and rather small, as a result, most of the clinical animal behaviors I know of don't only do private practice. They also have to do other things, myself included. So we need to do teaching, we need to do media work, we need to provide staff training for a veterinary clinic. We might also have to do commercial activities such as brand partnership and product consultation, you know, things like that. Now, the animal behavior industry is rather new and is not regulated. So the term behaviorist is not a protected title, and there isn't a standardized pathway of education. And there also isn't a centralized governance body. The education route can also vary depending on the geographical location, the jurisdictions, and to be honest with you, often is rather expensive and people find it very difficult to get into the industry. And also, there might not be a big market out there. Obviously, I've seen very encouraging trend during my career. There are more and more people out there who realize that the animal need mental health support, which is totally different than when I started my career. So I'm very positive about the development of this industry, but still, I think a lot more work need to be done for this industry. Also, another difficulty of getting into this industry is we often are self-employed, and being self-employed is not for everyone. It involves business skills, it involves marketing skill, communication skill. You even have to do your website most of the time. So you're also the IT manager. You also have to keep learning because the science moves all the time. I have to receive, like basically, I receive newsletter every week about new research coming out. I need to keep myself updated and read those research, but I'm not being paid while I'm reading those research. Is really not for everybody. I love my job and I wouldn't change it for anything, but I can understand some people, they might do this for a while and decide to change career, either going back to their old job or move on to the next things, because to be honest with you, it's not an easy industry. As I have mentioned, since this industry is not regulated, what should you do if you want to look for a professional to support your pet's mental health? First of all, you need to check what are the qualifications, and then you should also check that is a college degree, is the program accredited, what kind of professional experience they have, and have they been receiving continuous education. Because what I learned at the start of my career 16 years ago would be very different than what I do today. Science move on, and a lot of the stuff we did 16 years ago, we don't do it anymore, and we do something else. So it's something to think about. I hope you find this episode useful. And if there's anyone out there who aspire to join the industry, I would highly recommend you to reach out to me because I would love to speak to you. We do absolutely need more people to join this industry. Animal mental health is an up and coming industry, and we need more of you to join the industry. If you feel confused and not sure how to start, please reach out. I'll be very happy to speak to you. And remember, animal behavior isn't random. There's always a reason.